Good morning. Today we'll be presenting the broken heart syndrome. This will be through leaps, and this is made by Julie Martinez,
Florence Renteria,
and Emely Lopez. I'll be showing you guys our table of contents, which consists in blood pressure, introduction, childhood hypertension, methodology, and conclusion.
So blood pressure is the pressure of the blood in the circulatory system, often measured for diagnosis since it is closely related to the force and rate of the heartbeat and the diameter of the and elasticity of the arterial wall. There are 5 blood pressure categories, which are normal, elevated, high blood pressure, stage 1 and 2, and hypertensive crisis, which will be shown in the next slide.
In this slide, we can see the normal, elevated, high blood pressure stage 1, high blood pressure stage 2, and hypertensive crisis. For systolic, the normal blood pressure would be below 120. For diastolic would be below 80. For high blood pressure stage 1, systolic would be between 130 and 139. And for diastolic would be between 80 and 89. For hypertensive crisis, for systolic could be 180, above 180, and diastolic would be above 120. Contact help immediately if you are in the hypertensive crisis.
These are the key points. Untreated high blood pressure disease, stroke, heart attack, kidney damage. More information about it. High blood pressure is discovered more likely in adults, unlikely to get this disease at an early age. Medications can help control an abnormal blood pressure, and also it has to be a lot with their lifestyle that they may have. It's very important.
Introduction. Here we have a few things we must know. For example, systolic, which would be the systolic pressure, and diastolic would be the diastolic pressure. As talked about in slide 4, normal systolic blood pressure would be about 120 and a normal diastolic blood pressure would be about 80. mmHg is millimeters of mercury. Systolic pressure is the max pressure of the heart, which exerts while beating and functioning, and diastolic would be the blood pressure between heart beatings. Hypertension expands the danger of the scope of infections. These infections are such as the coronary illness, a stroke, cardiovascular breakdown, aortic aneurysm, chronic kidney disease, and retinal disease.
In this slide, we will be talking about health behavior leading to coronary artery risk, and which is health behavior has been associated with hypertension based on clinical blood pressure data with nocturnal hypertension and non-dipping systolic blood pressure are limited. The purpose of the study was explorative descriptive because the data collected contributed to the development of theory and explained phenomena from the perspective of the people being studied. No participants were mentioned, but in coronary artery risk development in young adults and the Jackson Heart Study, the participants were older, more likely to be female, African American, and have an annual family income of $25,000 or less. The patients were also more likely to be taking medication of antihypertensive. The Jackson Heart Study participants had higher clinic and sleep systolic blood pressure, with the coronary artery risk in young adults studied participants. The prevalence of nocturnal hypertension and non-dipping systolic blood pressure and diastolic blood pressure were higher in the Jackson Heart Study. A composite health behavior score was calculated as their sum and categorized as very good. The score range was between 6 to 8, as in 5 meaning good, 4 would be fair, and anything between 0 to 3 would be poor. Nocturnal hypertension associated with good, fair, and poor versus good health behavior scores were 1.03 and 0.88 and 0.96. The coronary artery risk development in young adults research and Jackson Heart Study participants had an outcome of 41.1% and 56.9% had nocturnal hypertension. The global sleep quality, duration, and the sleep efficiency were not associated with neither nocturnal hypertension or non-dipping systolic blood pressure. These findings suggest that addressing OSA risk and sleep timing in a clinical trial may be improved blood pressure during sleep.
The gift of life with complications. Here, they observed pregnant women who were at high risk of developing hypertension. These pregnant women were observed throughout their pregnancy through frequent visits to the doctor. The doctor did monitor their blood pressure through certain guidelines. These guidelines were ACC and AHA. They stand for American College of Cardiology and American Heart Association. These guidelines were used to determine if the hypertension in pregnant women had increased or decreased in a certain span of time or age. And they ended up concluding that pregnant women may encounter chronic hypertension after their pregnancy.
Systolic blood pressure intervention trial, because they compared old and young people to see her chances of having hypertension at a very young age. What are other diseases other people can have? This research is participant observation. Treatment arm within the slow systolic blood pressure and high systolic blood pressure. Spline regression analysis confirmed that baseline systolic blood pressure was associated with the risk of primary outcome. A normal systolic blood pressure is below 120.
In the leading trend of high sensitivity to death, the study was to connect between the circulating cardiac biomarkers and minor anomalies in cardiac phenotype in the left ventricle and mass mid-wall fractional shortening in elderly individuals in a broad society unit. The examination of hypertension is usually led by cardiac structural irregularities. Therefore, they assessed with high-sensitivity cardiac troponin and a marker of subclinical myocardial damage could classify individuals at a risk for hypertension or even left ventricular hypertrophy. They gathered data by testing the connection of baseline high-sensitivity cardiac troponin sections with occurrence diagnosed hypertension and with the disturbance of visit-based hypertension defined by self-report medication use or measured blood pressure between 140 through 190 mercury over 6 years.
Childhood hypertension cross-sectional study analyzed the National Health and Nutrition Examination Survey data. Application of the new guideline. These analyses include 3,633 children in 2005 to 2008 and 3,471 children in 2013 to 2016. Children in 2013 to 2016 were reclassified as hypertensive. The prevalence of high blood pressure also declined.
Control over thyself. Here we have people who have been diagnosed with hypertension or are in borderline about to get hypertension, and they have to go to a doctor to get diagnosed or to be prescribed medication. This would be treatment of what we know hypertension, the one and only silent killer. They must have frequent visits with their doctor. This is due to the doses of the treatment. The doctor may prescribe a large amount or a less amount of treatment for the antihypertensive medication. They must be accurate in taking their medication. This provides feedback on how the treatment is affecting them and provides a doctor monitoring them a much easier way. Depending on the feedback and on the results, the doctor may augmentate or decrease the doses of antihypertensive medication.
Methodology Spring 2020. In this slide, we will be talking about gathering data, and all materials will be included because due to the LEAPS program and the patients of our choice, we will be choosing either family or friends, and our goal is to bring awareness to our community about where we stand as a community. We'll be gathering data related to blood pressure in order to determine whether our community stands within the normalcy range. We will out our data into charts and graphs in order to bring awareness about where we stand as a community.
Conclusion. Blood pressure is one of the most common studied in clinical medicine. Defective or inappropriate equipment, consequence of aging, children, the obese, the elderly, and pregnant women. We are excited to gather our data, and we hope to see you here next semester.
These are our excited. And we would like to take the time to acknowledge Dr. De La Torre, Ms. Sabrina Rios, our student mentor, Dr. Nora Garza, Ms. Agüero Rojas, and Ms. Gabriela Solis Cavazos, and the Hispanic Servant Institute. We would like to thank you for taking the time to listen to our presentation. And if you have any questions, feel free to ask us. Thank you.
Thank you.